Gentlemen, I need to talk to you about something very serious that's affecting the health of thousands of men over 60 years old. A few weeks ago, a 67-year-old man came to my practice here in New York. Let's call him Mr. James. He came worried about high blood pressure, constant fatigue, and prostate problems. During the consultation, when we talked more privately, he confessed something to me that completely changed the course of the diagnosis. James had a habit he thought was harmless, that he did in his bathroom at home, always at the same time, always the same way, and he had no idea that this habit was damaging his heart, his prostate, and even his ability to feel pleasure. You know what I discovered? That Miss James was committing not one, but 5 of the 7 main mistakes that men over 60 make during masturbation. And before you think I'm going to talk about moralism or nonsense, let me be clear. There's nothing wrong with masturbation. It's part of a healthy sex life at any age. The problem isn't the act itself, but how you're doing it. I'm Dr. Theodore Chambers, urologist, specialized in men's health, and today I'm going to reveal to you the 7 most dangerous mistakes you may be making at this exact moment. Why am I talking about this? Because I'm tired of seeing wonderful men, family fathers, grandfathers, successful professionals suffering in silence with problems that could be avoided. Because sexual health after 60 isn't a luxury, it's a necessity. And because nobody else is going to tell you this honestly. The first thing you need to understand is that after 60 years, the male body goes through profound changes. Blood circulation isn't the same as when you were 30 or 40. Testosterone begins to decrease naturally. The prostate enlarges. All of this is normal. It's expected. But here's the problem. If you continue doing the same things you did 20 years ago without adapting anything, you're asking for trouble. I always tell my patients, imagine your body like a car. A brand new car easily handles a trip from New York to Boston without stopping, accelerating hard, without any problem. But a car with 30 years of use needs stops, better fuel, checking the oil, taking care of the suspension. With the body it's the same thing, and ignoring this is the recipe for disaster. Mistake number 1, using the wrong pressure. You know what Mr. James confessed to me? That over the years, he needed to squeeze harder and harder to feel pleasure. Doctor, it seems like I lost sensitivity, he told me. And you know why? Because he was literally training his body to only respond to extreme stimuli. Think with me. When you squeeze too hard, you're compressing the blood vessels, damaging local circulation, and over time harming the nerve endings. It's like you're slowly killing your body's ability to feel pleasure naturally. After 60, the nerves are already naturally less sensitive. If you also use excessive force, you're digging your own grave in terms of pleasure. And there's something else many men don't know. This excessive pressure can lead to what we call death grip syndrome. It's not literal death, of course, but it's the death of your ability to respond to soft, delicate touch, whether from your own hand or from your partner. Have you thought about that? That maybe the difficulty feeling pleasure with your wife isn't her fault or yours, but from this habit you created without realizing. I had a patient. Let's call him Mr. Robert, 64 years old, married 35 years. He sought me out desperately because he couldn't have relations with his wife anymore. Doctor, I simply feel nothing, he told me. After talking extensively, I discovered he was using a male masturbator with absurd pressure. His body simply forgot what natural touch felt like. He needed months of re-education to feel pleasure normally again. Mistake number 2, doing it in the bathroom. I know what you're thinking. Dr. Chambers, what's the problem? It's the most private place in the house. Yes, I understand. But let me explain what's happening with your body. First, the position. Most do it sitting on the toilet, right? In that position, you're completely compressing the pelvic region. The blood vessels that irrigate the penis, the prostate, all that region get pressed. After 60, your circulation is already slower. If you add this compression, you're creating a serious problem. Second, the rush. In the bathroom, nobody wants to take too long. So you speed up, get tense, breathe poorly, the heart races, pressure rises, and you don't even notice. I've seen cases of men who had cardiac arrhythmia, even beginnings of heart attacks, all because they were forcing too much in a closed environment without adequate ventilation. Third, the psychological association. When you always do it in the same place, the brain creates an association. After a while, you can only feel pleasure there. This limits your sex life tremendously. Mistake number 3, rushing the process. This one is the champion of problems. Did you know that most men over 60 that I treat take less than 3 minutes from start to finish? 3 minutes. That's a disaster. The male body needs time, especially after 60, for the entire cardiovascular system to prepare adequately. When you rush, the heart needs to pump blood very quickly. Blood pressure rises abruptly, and you put an enormous overload on the system. It's like doing a 100-meter sprint without warming up. You might achieve it, but you'll pay the price later. Besides, rushing the process means you're focused only on the final result, on orgasm, and you lose the whole journey, all the pleasure of the path. Healthy masturbation, especially at this age, should be a moment of connection with your own body, of exploration, of relaxation, not a race against time. I usually guide my patients, dedicate at least 10 to 15 minutes. Start slowly, explore different types of touch, breathe deeply, and let the body respond naturally. Mistake number 4, not using adequate lubrication. Look, this is basic, but you can't imagine how many men ignore it. After 60, the skin becomes thinner, more sensitive, more prone to micro-lesions. If you keep rubbing without lubrication, you're creating small fissures in the skin that can inflame, infect, and cause serious problems. And I'm not talking about using just anything. No soap, shampoo, or toothpaste. For God's sake, these substances can irritate the mucosa too much. Use a water-based lubricant made for this. You find it at any pharmacy. It's not expensive, and it will make an enormous difference. I had a patient, Mr. William, 62 years old, who came with his penis completely irritated, red, burning. He was ashamed to tell, but when I insisted, he confessed he'd been using soap for years. The man was literally hurting himself. After he started using adequate lubricant, in 2 weeks, everything was resolved. Mistake number 5, depending exclusively on pornography. Look, I'm not going to get into the moral merit of watching pornography or not. Everyone knows their life, but from a medical standpoint, I need to alert you about a serious problem. Dopamine. When you watch pornography, especially the more intense ones, the brain releases an enormous amount of dopamine. It's the hormone of pleasure, of reward. The problem is that the brain gets used to that level of stimulation. After a while, it only responds to that type of extreme visual stimulus. You become literally addicted. And then what happens? You can't feel desire for your wife anymore. You can't get an erection without watching pornography. You completely lose the ability to get aroused with natural, real stimuli. There's a recent study done right here in the United States that showed that men over 60 who consume pornography daily have 3 times more chances of developing erectile dysfunction compared to those who don't consume or consume sporadically. 3 times. That's a lot. If you identify with this, my recommendation is try to do a detox. Spend at least 30 days without watching any pornography. The first days will be difficult, your brain will gacken, but then you'll notice that your sensitivity returns. You'll get aroused again by simple, natural, real things. Mistake number 6. Abusing very intense sex toys. I know some of you use male masturbators, those devices with vibration, suction, automated movement. And look, there's no problem using them occasionally. The problem is when you use them always, every day, and put them at maximum intensity. You know what happens? The same thing as with excessive manual pressure, only worse. These devices create such intense, such artificial stimulation that the brain and body get used only to that. Then, when you try to have real sex with your partner, you simply can't feel anything. I had a remarkable case. Mr. Michael, 66 years old, sought me out desperate. He had bought a high-end masturbator and used it every day. After 6 months, he realized he couldn't have relations with his wife anymore. He simply felt no pleasure. He was devastated. The marriage was in crisis. He needed 4 months without using the device, doing sensitization exercises to manage to recover natural sensitivity. If you use these devices, my recommendation, limit use to maximum twice a week and never use them at maximum power. Always start at the lowest. Your body needs to stay responsive to natural stimuli. Mistake number 7, not balancing with real intimacy. This one is fundamental and many completely ignore it. Look, masturbation is healthy, is normal, is part of sexuality, but it can't replace the real intimate connection with another person. I see many men who masturbate every day, sometimes even twice a day, but go weeks without having intimacy with their wife. When the wife complains, they say they don't feel like it, that they're tired, that they have erection problems. The problem is that you're spending all your sexual energy alone. After 60, sexual recovery takes longer. If you had an orgasm this morning in the bathroom, you can be sure that tonight when your wife wants it, you won't be able to respond the same way. It's physiological. There's no way to trick the body. I had a patient, wife of a 65-year-old man, who sought me out in tears. She discovered that her husband was masturbating secretly every day, but hadn't had sex with her for 2 months. She felt rejected, ugly, unwanted. When I talked with him, I realized he had created an addictive routine where masturbation was easier, faster, without needing to worry about performance, about satisfying the partner. But this was destroying his marriage. The guidance I gave was establish a priority. If you're in a relationship, intimacy with your partner should come first. Masturbation is complement, not substitution. And look, this transformed their relationship. He started to reserve his sexual energy for moments together, and when he really needed it, then he masturbated. The marriage improved. Her self-esteem returned, and he realized that shared pleasure is much greater. Now, what can you do today to change this? First, have awareness. Are you committing any of these 7 mistakes? Be honest with yourself. You don't need to feel shame, just recognize it. Second, make small changes. You don't need to change everything at once. Start with one thing. Use adequate lubricant, change the place, or decrease the frequency of pornography. One step at a time. Third, talk with your partner, if you have one. Be honest. She'll prefer 1,000 times an open conversation than living in uncertainty thinking the problem is with her. Fourth, seek professional help if necessary. If you realize you can't change alone, that you're addicted to pornography, or that you have more serious sexual health problems, seek a urologist. There's no shame in that. And look, one last thing I want to make very clear. Your body still works. Your desire still exists. Your ability to feel pleasure is there. You just need to learn to respect the natural changes of age and adapt your habits. I've seen men of 70, 75, even 80 years completely recover their sex life after making these changes. Your body deserves respect, deserves care, deserves attention. If this video helped you in any way, if you recognized any of these mistakes, leave a comment, and if you have any friend, brother or father who could benefit from this information, share this video with him. Sometimes we need a little push to start taking better care of our health. I'm Dr. Theodore Chambers, and I'll always be here bringing quality information, without taboos, without judgment, to help you live better. Take good care of yourself.